Here's our game plan. First up, we'll get a picture of what the heart's perfect rhythm is supposed to look like. Then, we'll dive into what happens when that beat goes wrong. After that, we'll explore the two main ways it can mess up, going too fast or too slow. Then, we'll play detective and see how doctors find the glitch. And finally, we'll look at the amazing ways they get your heart right back in sync. All right, let's kick things off with Section 1. We're talking all about the heart's perfect rhythm, and we're going to uncover the secret to its incredible built-in pacemaker. So before we can even talk about what's abnormal, we have to ask a pretty basic question. What exactly is a normal heartbeat? It's way more than just a simple thump-thump. It's this incredibly precise, coordinated electrical dance. You see, a healthy heart beats because it has this amazing internal wiring system, and it all starts in a tiny spot called the SA node. You can think of the SA node as the heart's own natural pacemaker, its little command center. It fires off a regular electrical signal, which then travels through the heart in a very specific pattern, telling every part of the muscle exactly when to contract. It's that coordination that gives you a strong, steady beat. Okay, so that's the ideal. But what happens when there's a glitch in that system? That brings us right to Section 2, when the beat goes wrong. The official medical term for one of these glitches is an arrhythmia, and the definition is actually pretty straightforward. It's any kind of abnormality in the heart's rhythm or its rate. It's basically a catch-all term for any time the heart deviates from that steady, coordinated beat we just talked about. Now, these glitches really boil down to two main problems. On one hand, you can have a problem with impulse formation. That means the electrical spark itself is faulty from the get-go. Or you can have a problem with impulse conduction. In that case, the spark might be perfectly fine, but the wiring is bad, so the signal gets lost, delayed, or takes a wrong turn along the way.
So now that we know how the signal can go wrong, let's look at the main types of arrhythmia. This brings us to Section 3, too fast versus too slow. This is really the simplest, most intuitive way to start classifying them.
And this breaks it down perfectly. On the left, you've got tachyarrhythmias. Think tachy like a tachometer for fast. That's when the heart beats too quickly. And on the right, you have Bradyarrhythmias. Brady means slow, and you guessed it, that's when the heart rate is too low. To make this all feel a bit more real, let's put a spotlight on the most common persistent arrhythmia out there, which falls squarely into that too fast camp. Atrial fibrillation, or as most people call it, AFib. And we're not talking about some super rare condition here. AFib affects a pretty significant 1 to 2% of everybody. With our population getting older, that number is actually expected to double in the next few decades, which makes this a really huge public health issue. So what does this actually look like to a doctor? Well, on an ECG, which measures the heart's electrical activity, AFib is just pure chaos. The timing between each heartbeat is all over the place. You also lose what's called the P wave, which is the little electrical signature that the top chambers of the heart are squeezing normally. Without it, we know those top chambers are just quivering, totally chaotically, at over 300 beats per minute. And this electrical chaos has some really serious real-world consequences. Because those top chambers are just quivering instead of pumping effectively, blood can pool there. And when blood just sits around, it can form clots. If one of those clots breaks free and travels to the brain, it causes a stroke. This is the single biggest danger of AFib. It's also linked to a doubled risk of death, tons of hospital visits, and just an overall poor quality of life. Okay, so that's the too fast and chaotic side of things. Now let's completely flip the coin and look at the too slow category. And our main example here is going to be heart block. Remember how we talked about a problem with conduction, the wiring? Well, that's heart block in a nutshell. It's when that electrical signal gets held up or even completely stopped on its way from the top chambers, the atria, down to the main pumping chambers, the ventricles. And it's not just one thing. It actually comes in different degrees of severity. In first-degree heart block, every signal gets through. It's just a little bit slow. A lot of people don't even notice it. In second degree, it's a bit more serious. Some signals make it, but others get dropped completely. That can definitely make you feel dizzy. And then there's third degree, or complete heart block. This is a total communication breakdown. None of the signals get through, and that is absolutely a medical emergency. So with all these different ways the heart's rhythm can go haywire, how on earth do doctors figure out exactly what's going on? Well, that brings us to Section 4, where we're going to explore the diagnostic journey. It's a lot like good detective work. It always starts with the clues, listening to the patient's story and doing a physical exam. But the star witness, the key piece of evidence, is almost always the electrocardiogram, the ECG. It's like putting a wiretap on the heart's electrical system, letting doctors see exactly what's happening. And if an arrhythmia likes to play hide and seek and doesn't show up at the doctor's office, they might use something called a Holter monitor, which is a portable ECG that records your heart for 24 hours or more.
And that brings us to our final section, the one everyone probably wants to know about. Once the glitch is found, then what? It's time for section 5, getting back in sync.
Generally speaking, treatment for arrhythmias stands on 3 main pillars. First, you have medications. Second is what we call electrotherapy, which means using smart electrical devices. And third, in some specific cases, you might have surgical therapy to physically correct the problem. But when you're dealing with something as complex as AFib, it's not just about picking a tool from the toolbox. Doctors actually have to make a really fundamental, strategic choice first. And this is the big decision right here. Do they go for rate control? You can think of this as just accepting the chaotic rhythm but putting a speed limit on it to make the patient feel better. Or do they aim for rhythm control? This is the more ambitious goal of trying to completely restore law and order and get the heart back into a normal, steady rhythm. Which path they choose really depends on the individual patient. And here are just a few of the powerful tools in their arsenal. For that chaotic rhythm of AFib, they might use something called cardioversion, which is basically an electrical reboot for the heart. For more stubborn problems, ablation therapy lets them go in and very precisely zap the little spots of heart tissue that are causing the faulty signals. And, of course, for those too slow problems like heart block, a pacemaker acts as an artificial backup generator, making sure the heart never beats dangerously slow. When you think about it, from the perfect, steady rhythm of that tiny SA node to the chaos of AFib and the scary pauses of heart block, the heart's electrical system is just a marvel. Understanding these glitches isn't just for doctors. It's about learning the language of our own bodies. And it's a good reminder that every once in a while, it's worth it to just pause and ask yourself, is it time to listen to your heart?